Hi everyone, this is Purple Sparks. Today is day 2 of Epilepsy Awareness Month. Today's topic is understanding seizures, its origin and its brain activity. Seizures result from abnormal, excessive and synchronous neuronal discharges in the cerebral cortex, which disrupts the brain's balanced electrical activity. Under normal circumstances, there is balanced electrical circuit maintained in our brain. It works like a finely tuned circuit where there are these excitatory signals, which are the glutamate neurotransmitters, which causes firing of the neurons, and there are inhibitory GABA signals, which causes dampening of this excessive activity. Together, they maintain this precise equilibrium, which prevents hyperexcitability and seizures. There are many causes for seizures, but when you come to the cellular mechanisms, there are mainly 4. Starting from ion channel dysfunction, there can be alterations in the sodium, potassium, calcium, and chloride channels, which destabilizes the neuronal membranes, which leads to excessive firing. Also, there can be glutamate receptor overactivation. So, there is excessive glutamate, which goes and stimulates NMDA receptor and AMPA receptors, which in turn increases the calcium influx and which leads to hyperexcitability. And there can be astrocyte dysfunction, which mainly has the function of potassium buffering and glutamate clearance. So if the astrocyte is damaged, there is excessive potassium and glutamate, which leads to hyperexcitability. Or there can be deficiency in the dampening signals, where this GABAergic inhibition is there. There is insufficient GABA release, or there is receptor for the GABA, which is not working properly. Coming to other causes for seizure, there can be structural abnormality in the brain itself. So something like tumors or cortical malformations, or there can be metabolic disturbances like hypoglycemia and electrolyte imbalance. There can be infectious causes like encephalitis and meningitis, which provokes inflammatory reactions, which in turn leads to neuronal instability. There can be genetic mutations, which causes defects in ionic channels and neurotransmitters, which alters the neural signaling. There can be exposure to toxins like drug overdoses and neurotoxins, which increases the neuronal hyperexcitability. These factors raises membrane hyperexcitability, triggering seizures by disrupting normal neuronal balance. So moving on further, we have many types of seizures along with their particular salient feature and their effect on consciousness. Firstly, we have the focal aware or simple partial seizures, where there is localized motor or sensory symptoms without impaired awareness. Example, limb jerking or deja vu. Secondly, there is focal impaired awareness or complex partial seizures. In this, there is impaired consciousness along with automatisms like lip smacking, and there is also post-ictal confusion. So what is post-ictal confusion? Mainly, the ictal phase is the phase of seizure. So anything after the period of seizure is called post-ictal phase. So it is a confusion or disorientation lasting for minutes to hours, indicating neuronal exhaustion. Think of it like this way. In post-ictal phase, your brain is actively working to restore the normal inhibitory control after the state of hyperexcitability. So it's like a regulatory mechanism. So in this phase, the patient or the person who has been affected by the seizure will have confusion, disorientation, headache, fatigue. These are the frequently reported signs of brain recovery or the post-ictal confusion. Next, moving on to general tonic-clonic seizures or GTCS, there is sudden loss of consciousness, tonic stiffening, the stiffening of the muscles, and there are clonic jerks, the involuntary jerky movements of the limbs, and there is post-ictal sleep, and also this can also cause seizure, injuries. And there is some seizures called as absent seizures or petit mal seizures. In this case, there is brief staring or unresponsiveness lasting about 5 to 10 seconds, and there is immediate recovery. These are seen commonly in children. And we have other types of seizures like myoclonic, atonic, or tonic. In myotonic, we have sudden jerks. In atonic, we have brief loss of muscle tone. And in tonic type, we have stiffening of the muscles. A seizure is a brain's electrical system misfiring, a moment when too many neurons spark together, disrupting the balance between excitation and inhibition. Normal brain function depends upon precise balance between glutamate-mediated excitation and GABAergic inhibition. This hypersynchronous firing can remain focal, that is, confined to a particular region in the brain, or generalized via commissural fibers and subcortical pathways. It can be temporarily overriding the normal brain activity. So, understanding these physiological mechanisms improves epilepsy diagnosis, its treatment, and patient outcomes, which also further enhances awareness about epilepsy and promotes health education. So that on daily basis, when we attend clinical postings or when we practice as a practitioner, these are the things that matters. So the content was created from 2 textbooks. Those are the Harrison's Principles of Internal Medicine, 21st edition. The chapter is 318, Seizures and Epilepsy. And we have Adams and Victor's Principles of Neurology, 12th edition. Chapter 16, Epilepsy and Other Seizure Disorders. Thank you.